Have you ever gone to therapy and went, I literally have too much to talk about, what do I choose? Well, have I got the perfect wheel for you. Happy Thursday. I am Dr. Jordan Soper, a board-certified behavioral and cognitive psychologist, as well as a certified sex therapist. Welcome back to another episode of Therapy Thursday, where we talk about common themes that just keep on rolling and keep on rolling and keep on rolling in therapy, so we can talk a little bit about some commonalities. Do any of the themes on the wheel this week relate to your experience? Well, let's find out which one we're going to be talking about today. Let's spin the wheel. Ooh, that was a good spin. Ooh, diagnosis versus symptoms. This is gonna be a fun one. So when we look at actually diagnosing someone with a mental health condition, there are what we call a criteria set of symptoms. This is a collection of symptoms, behavioral, cognitive, emotional symptoms that a person experiences. And when they meet a certain number of those symptoms, they then meet the diagnostic criteria. So they now have a diagnosis. Experiencing individual symptoms, a diagnosis does not make. It must be a combination of these symptoms or these cluster of symptoms, as well as ruling out other things that would better explain the symptoms. For those of us who have mental health symptoms, we may not have a mental health condition. And I know I'm getting in the weeds here, but this is something I feel super passionate about. The majority of us should experience symptoms of anxiety, symptoms of sadness or depression, but having those does not mean you have an anxiety disorder or a depressive disorder. It does take a little bit more detail, really being able to personalize it to your own individual experience to understand, is what you're experiencing a collection of symptoms, which we definitely want to address, don't get me wrong, want to address those, but that might be different than a diagnosis. It is that difference between how we conceptualize and think about mental health. As long as you have a brain, you have mental health. It should be a part of it. But mental health symptoms, a diagnosis does not make. So what questions do you have about the difference between symptoms versus a diagnosis? Feel free to put those down in the comments below, and I will see you next week for another episode of Therapy Thursday.